And we are now live. Good morning, Erin.
Good morning.
Great, we can see you and hear you.
Thank you.
Good morning, Steve.
Good morning.
Sounds good, thank you.
Thank you.
Good morning, Miguel.
Good morning. Can you hear me?
Sounds good, thank you.
Perfect. Thank you.
I see Rich there but with a photo that doesn't look like Rich. Good morning. Looks like your microphone's on. Whoever's under Rich Mead, can you clarify?
Oh, hi. I'm Aquila Powell. I'm with Prime Policy Group.
Okay.
Rich sent me this link. I'm not sure why it's showing him and not me.
They're personal links. If you could just spell your name for me, I'll rename you.
Sure. It's Aquila, Aquila, Powell, Aquila.Powell at Prime.
Oh, that's okay. So it looks like I've changed your title there. Is that correct?
Yes, it is. Thank you.
Okay, then you are good to go. Thank you. And
Good morning. This is Supervisor Simidian. Can you hear me loud and clear?
Recording in progress.
We can, and you are recording and ready to go. Nancy is your clerk today.
Thank you very much.
Good morning.
Good morning, all. We're having a little technical difficulty at my end. I apologize, but I think we're good to go now. We want to welcome all of you to today's meeting. The first time of business is, of course, the call to order. So we will call to order at 10:03 a.m. and we will ask the clerk to call the roll.
Vice Chairperson Lee
Good morning, President.
and Chairperson Simidian.
Present. Thank you very much. Quorum has been established, and now it's time to go to public comment. That portion of our agenda set aside for comment by members of the public on non-agendized items that are properly within the jurisdiction of the committee. Let me ask the clerk if we have any speakers under public comment.
There are none.
All right, thank you. That takes us then to item number 3, which is to approve the consent calendar. And the consent calendar day is just items 9 through 11. Let me ask Supervisor Lee if I can get a motion to approve the consent calendar.
Yes, move to approve the consent.
All right, I will second. Let me check with the clerk, see if we have any comments on the consent calendar.
There are none.
All right, then let's call the roll.
Vice Chairperson Lee
Aye.
and Chairperson Simidian.
Aye. All right, consent calendar is approved unanimously. Thank you very much. That takes us to item number 4, which is the chair and vice chair's verbal reports. I have none today. Supervisor Lee, anything you want to share on the federal front?
None as well. Certainly looking forward to listen to the update from our counselors in DC. Sounds like there's not a lot going on the Bring Back Better so far, but we'll hear about that later. Thank you.
All right, thank you. Likewise. That then takes us to item number 5, which is to get the report from the CEO's office. And I think we turn to Ms. Christian for that. Ms. Christian, are you with us today?
She is here. I see her in the room.
She needs to unmute perhaps and let us see her. We may have startled her by getting to this item as quickly as we have. There she is.
Yes.
I think.
Good-
There she
good-
is.
Yes, thank you. I was trying to find all the different buttons on all the different screens. Good morning, Chairperson Simidian and Vice Chairperson Lee, Danielle Christian, Legislative Manager. Happy New Year. Today I have 2 very brief updates that I want to share with you. One will probably be expanded on a little bit more under item 7, but the first is a federal budget update. As you may be aware, in December, Congress passed a second continuing resolution to keep the government funded until February 18th of this year. This means that there will not be any increases in government funding until at the earliest 1/3 of the way through the federal fiscal year. The 2 houses still have much work to do, and as of last week, there was thought that Congress would be looking to pass an omnibus bill rather than 12 separate appropriations bills. As the process continues, intergovernmental relations and the administration will keep you informed, including anything that we learn about the $1 million community project funding request for the API community health worker pilot that Congressmember Khanna secured for the county. That's in one of the appropriation bills, and we're hoping that if an omnibus is put together, it will remain in that in that bill and be funded. The second update is on the Violence Against Women Act. It's been a few years since we provided some information on this issue to your task force. But I want to share with you that a bipartisan group of lawmakers recently announced a deal on a framework to reauthorize the Violence Against Women Act, also known as VAWA. And they hope to introduce legislation in the next few weeks. VAWA seeks to bolster domestic violence responses at multiple levels of government. Its programs target the crimes of intimate partner violence, dating violence, sexual assault, stalking, and sex trafficking. The act was made into law in 1994 and has been reauthorized 3 years since then. Its last reauthorization was approved by Congress in 2013 and expired 5 years later, after lawmakers failed to renew it. If this latest effort is successful, it would mark the first time in almost 9 years that VAWA has been authorized. But while authorizations for VAWA have lapsed, Congress has continued to approve funding for its programs and annual spending bills. Once the legislation is introduced, we'll quickly review it, and we intend to send letters of support to our federal delegation and offer opportunities where we might be helpful or be able to provide local impact information to our legislators. And with that, I'm happy to answer any questions.
Supervisor Lee, any questions?
None for me. Thank you.
All right, thank you, Ms. Christian. I think when we get into items 7 and 8, we'll have a more robust set of back and forths for you all. But that does take us to item number 6, which is the County Council's report. Mr. Press, would you like to share with us? Thank you for the grid.
Yes, good morning, Chairperson Simidian and Vice Chairperson Lee. Wanted to focus on 4 matters today, all of which are administrative rules and regulations, which tells you something about where the action is these days. So the 4 are the Supreme Court vaccine mandate cases that were decided last week that were in the news. So I'll have a little bit more discussion on that. And then just very briefly wanted to just give you some updates on the sunset rule, the public charge rule, and also the Title IX rule update that we've been discussing at meetings past. So let me first start with the 2 vaccine mandate cases. These were both heard and decided by the Supreme Court. They were heard, I guess it was around 2 weeks ago, and then the decisions came out late last week. The first case, which has sort of been renamed as Biden versus Missouri. This appears on page 50 of the County Council chart. This was about a rule issued by the Federal Health and Human Services Agency that required at those facilities that received funding for Medicaid and Medicare, which is quite a few facilities in the country, that all staff, or well, I would say most staff, had to be vaccinated, or if not vaccinated, they had to qualify for a medical or religious exemption. Now, that covers about 10 million workers, and this was subject to some challenges in various courts around the nation. Some lower courts actually entered injunctions against this rule. And what the Supreme Court did by a 5-4 vote was to stay those injunctions, meaning stop the injunctions, meaning that this Federal Health and Human Services rule could actually go into effect. So what that means then is that by January 27th, that's next week, this rule will become effective. And again, this relates to healthcare facilities that receive Medicare and Medicaid funding, which of course all of our county hospitals and clinics do. The critical thing here, though, is that, again, we're talking about an administrative rule, which for the general public is an issue about Congress, as you know, normally passes the laws and then delegates authority to federal administrative agencies to essentially fill in the gaps, fill in details about how a law is to be implemented. And that's usually done by rules, regulations, and other guidance. So a question that often comes up in a lot of the litigation that we've been following and frankly participating in is how well did that federal agency follow the law as far as promulgating rules, regulations, or guidance, and whether it did so with appropriate authority. Here, in this Biden versus Missouri federal HHS case, the Supreme Court said that the Social Security Act that authorizes, I should say, still, Medicare and Medicaid, it literally requires, as one would imagine, that healthcare providers for those programs protect patient health and safety. And so a rule then requiring people to be vaccinated, workers to be vaccinated against COVID-19, as the Supreme Court held, quote, fits nicely within that congressional command to the federal agency. And I focus on that because that fit issue of federal administrative action to statute stands in stark contrast to the other vaccine mandate case that probably got a little bit more publicity last week. And this was a case that's called National Federation of Independent Business versus Department of Labor. This is on page 54 of the chart. And in this instance, the federal administrative agency that was acting was not the Health and Human Services Agency. It was the Occupational Safety and Health Administration, or OSHA. And what they did is they had statutory authority to use the vehicle. They issued what's called an emergency temporary standard, and what they call an ETS. It's essentially an emergency regulation. And what this was designed to do was to require all employers with 100 or more employees, which incidentally covers
Mr. Press, I would look to Supervisor Lee and see if he's nodding as I say, you've frozen on me. I don't know if that's at my end or at your end.
Oh, sorry. Can you hear me now? Can you hear me now? Oops.
I can hear you, yes.
We can hear you fairly well, Chairperson Simidian. You look like you are frozen, if you can hear me.
Thus begging the question as to who is frozen. Am I unfrozen?
Yes, we can hear you just fine.
Okay. Chairperson Simidian, can you hear me? I will pause. Looks like there's some technical difficulty here.
He appears to be part of the Zoom webinar and has turned off his camera, maybe to see if he can get a stronger connection.
Okay.
That is correct. Thank you.
Chairperson Simidian, should we continue?
Can you hear me now?
Yes.
All right. I've, as you discerned, I turned off the video in the hopes that I'd get a stronger signal here. I think we're doing okay. Why don't you go right ahead, Mr. Press, and I apologize for the technical difficulties today.
No problem. So can you hear me okay now?
Loud and clear. Thank you.
Great. Okay. So not sure where I froze, but to just back up ever so slightly. So in this other case about an OSHA rule, this required all employers with 100 or more employees, which covers roughly 2/3 of the private sector and approximately 84 million workers, that those employees, the employers rather, would have to ensure that their employees were either fully vaccinated or tested weekly and wear masks. And here, in contrast to the HHS case, the court said that we expect, quote, we expect Congress to speak clearly when authorizing an agency to exercise powers of vast economic and political significance. And here, unlike the HHS case, the court held that Congress did not so clearly authorize OSHA to regulate beyond what it called occupational hazards. And the court explained that although COVID-19 is a risk that occurs in many workplaces, it is not an occupational hazard in most. The court went on to say that COVID-19 can and does, as we well know, spread at home, in schools, during sporting events, and everywhere else people gather. And thus the court characterized COVID-19 as, quote, a universal risk. And as such, it held that OSHA could not, quote, regulate the hazards of daily life. So in that instance, by a 6-3 vote, the court held that OSHA did not have congressional authorization or delegation to issue the broad rule that it did. I will say, though, at the end of the opinion, the court did at least leave the door open to potentially further regulation in the occupational realm by OSHA by noting that where the virus possesses a special danger because of the particular features of an employee's job or workplace, targeted regulations are plainly permissible. So that's helpful language, although frankly, from a practical perspective, as we have seen from cases that have long been on our county council chart and other cases that are still in the works, issuing even emergency regulations or guidance can take some time. And so query whether from a practical standpoint, this may simply be beyond OSHA's reach at this point. So those are the two sort of big vaccine mandate cases that went to the Supreme Court last week in the news. Any questions on either of those?
Supervisor Lee, questions?
None for me. Thank you.
None for me, Mr. Press. The short version, I gather, is that the world is very different in a healthcare setting than in other business settings. Yes?
Absolutely. And I would note, I just read just a few minutes ago that the Supreme Court, I believe this very morning, turned away another request to block the masking rule on airlines, I think for similar reasons that, again, regulating masking on airlines, regulating vaccination in a healthcare work setting is more particular. And I guess, and also, frankly, as the court said, that there's a clearer nexus between the congressional authorization and the regulation. Okay, so let me just quickly then.
All right, thank you.
Yeah, so let me go to the other updates. Let me just very quickly talk about the sunset rule. And for the general public, just very briefly, the sunset rule. This was a regulation that issued truly in the last moments of the last federal administration. And that what this was is that it was a requirement that again, the federal HHS was supposed to go back and re-examine and evaluate all of its more than 17,000 regulations covering everything from Medicare and Medicaid to food safety and public health. And if it did not conduct these very detailed analyses in the next few years, then the regulations would start to expire automatically. So pretty dramatic. So what this board did, this board authorized the county to lead and join along with other several nonprofits in a lawsuit against that very rule. Now, we ended up having to bring the lawsuit against the Biden administration because, of course, the Biden administration had taken office by last March. And as soon as we filed the new federally led HHS immediately delayed the effective date of this sunset rule. It was supposed to be March of 2021, and they delayed it until March of 2022. And then last October, the federal HHS submitted what's called a notice of proposed rulemaking, asking the general public, should we repeal or withdraw or modify the sunset rule. We submitted our county comments, strongly recommending full repeal of the sunset rule in late December. And so we are now waiting for the federal HHS to continue to collect those comments and then ultimately take some sort of regulatory action on the sunset rule. So as we discussed in meetings past, the regulatory route, the unzipping and undoing and unraveling of regulations sometimes takes as much time as promulgating them. So this is a process that's going to be underway for some period of time. Any comments, questions about the sunset rule?
Supervisor Lee?
Yeah, so at the end of the day, when do you think this potentially will come out so that we could get rid of it once and for all?
I'm expecting sometime this year. But certainly they're going to have to take some action as far as the effective date for the current sunset rule, which is set to become effective in a little over a month. But we'll keep following that.
Okay, thank you.
And then next, just a brief update on the public charge rule. And again, just for to remind folks, this was another action that this board authorized our office to take back in 2019. The board gave us authority to bring a lawsuit along with the city and county of San Francisco, which was the first lawsuit in the nation to challenge the public charge rule. And if one may recall, the issue was that traditionally, frankly, for decades, the Federal Immigration and Nationality Act gave the federal government the authority to deny admission or adjustment of status to certain non-citizens that were determined to be, quote, likely at any time to become a public charge, unquote. And what that usually meant for decades was that to be considered or to be determined to be a public charge, one had to be primarily dependent on public benefits, and specifically those public benefits that were the more cash benefit variety. The public charge rule, which came out during the Trump administration, changed this longstanding interpretation dramatically, first by sweeping in non-cash benefits as part of the evaluation, which includes Medicaid, supplemental nutrition assistance, otherwise known as food stamps, even Section 8 housing. And rather than focusing on whether someone was primarily dependent upon public benefits, it changed that definition to be that you took any of these public benefits for 12 months within a 36-month period, even if some of those benefits literally amounted to only pennies per day. So we brought a lawsuit. Our injunction was issued. It was affirmed as well. A preliminary injunction was affirmed as well. This was on its way to the Supreme Court by way of the prior federal administration, but then the incoming Biden administration agreed to a stipulated dismissal of the Supreme Court challenge. So the Supreme Court did issue it. Then a group of, and we're seeing a lot more of this, a group of so-called red states moved to intervene in the lawsuit in the Ninth Circuit, asserting that they should be the ones to take up the defense of the public charge rule when the federal government chose not to. And this, if you look over time, these types of lawsuits have happened quite a few times in the last 15, 20 years when incoming change of administration has a different view on the preceding administration's activities. Here, though, the Supreme Court agreed to hear these so-called red states' motion to intervene challenge the Ninth Circuit denied intervention, and now that denial of intervention is what is before the U.S. Supreme Court. We filed papers on this matter late last week. An oral argument is set for February 23rd of this year, so just a little over a month. So we're going to be reporting on that shortly. Any questions on the sunset rule? Sorry, not the public charge rule. Supervisor Smitty, you are muted.
We're on our third device now. How's this one working, Mr. Pratt?
I can hear you loud and clear.
All right, thank you. I think you have video, yes?
Yes.
All right, such as it is. I'm good. Let me turn to Supervisor Lee and see if he has questions. Supervisor?
Yes, thank you. So my question is, since the public charge rule has now been expanded to include not only cash, but you say Section 8 housing voucher, food stamp, health benefits, by the motion we are doing and what the administration is doing, at the end of the day, we expected all that, would that be reverted back, or the definition of public charge will be permanently including those items?
Well, technically, that text of the public charge rule has actually been repealed by the federal government.
Mm-hmm.
So now this is what's odd about our case is about a preliminary injunction.
Mm-hmm.
The real case is a case emanating, in my opinion, is a case emanating from the Seventh Circuit, which was a case where the court there actually vacated the public charge rule. So the way we are viewing, and we put this in our papers, the way we are viewing this challenge is that this group of red states is hoping to get some sort of favorable authority to help it in its challenge in the Seventh Circuit case, where one could say that's where the real action is on the public charge rule. But right now, the public charge rule is effectively dead.
Okay, thank you.
All right. Now, the last one, just wanted to very briefly talk about the Title IX rules that were the substance, the sort of the essence of which, I should say, was the subject of the Serve Justice lawsuit. You may recall, Serve Justice lawsuit was brought against the federal guidance of the last federal administration that preceded what ultimately were Title IX rules that issued in May of 2020. So the Serve Justice case, they had a summary judgment motion issued against the plaintiffs in that case. That's on the Ninth Circuit. That appeal has been held in abeyance for the entire time that the rule has been promulgated. The rule was then challenged by a number of lawsuits around the nation, and now stayed further because, as we reported in earlier meetings of this task force, last March, President Biden issued his executive order requiring the federal Department of Education to specifically revisit the Title IX rules that former Secretary DeVos promulgated in May of 2020. And just last month, the Federal Department of Education announced that a notice of proposed rulemaking was intended to issue this coming April. And specifically, they said that this forthcoming proposed rule was going to address a number of issues, but ones I wanted to cite because I know that there have been people who have been following this very closely. So three provisions of the federal rule the Department of Labor has said we are going to focus on, and I'm going to give the citations for folks. This is at 34 Code of Federal Regulations, or CFR, section 106.8, which refers to designation of coordinator, dissemination of policy, and adoption of grievance procedures. Section 106.44, recipient's response to sexual harassment, and 106.45, grievance process for formal complaints of sexual harassment. So once that notice of proposed rulemaking issues in April, I would think it would be highly likely that the county would be submitting comment letters to those new proposed rules. Any
further
questions?
questions? Professor Lee?
Nope, thank you.
All right, and thank you, Mr. Press, for those updates. These are all items that our board has had and this committee has had particular interest in staying on top of. Let me just check because I can see Supervisor Lee on my screen. I'll look to him to be my tech advisor. Supervisor Lee, are you able to both see me and hear me clearly now?
Yes, both see
All right.
you and hear you clearly.
Thank you. We've finally been reduced to using the iPhone as the one functional piece of equipment given the state of our internet here. All right, we're going to move on then to the next item, which is item number 7, which is to receive the verbal report from the Office of the County Executive with respect to the status of federal executive and legislative actions in response, particularly to COVID-19. And we specifically wanted to include, although we're not limited to, talking about at-home testing and federal relief funding. So let me just first confirm with the clerk, we did not have speakers on that prior item. I certainly didn't see any hands raised.
That is correct.
All right, then let's move on to item number 7. Ms. Christian, how would you like to walk us through this item?
Thank you very much, Chairperson Simitian. We have Deputy County Executive Martha Lipinski, who's going to provide a report on the American Rescue Plan and the final rule that the U.S. Treasury Department recently released. Aaron Dorton's going to follow up with a report on federal testing efforts. Rich Mead from Prime Policy Group, and I'm sorry, Aaron's also with Prime Policy Group, is going to provide a budget update and be followed by Akila Powell from Prime Policy Group to provide information, any new and breaking news related to another stimulus effort for COVID. So those will be the 4 speakers on this item. And with that, I'd like to turn it over to Deputy County Executive Martha Lipinski.
Thank you, Danielle, and thank you to the committee for the invitation to provide an update on the American Rescue Plan and the final rule that just came out on January 6th. So before I go over the key changes in the ARPA funding rule, I'd like to make a couple of points to catch us up to where we are today. Just a reminder that the county's allocation for American Rescue Plan funds is $374.4 million. It's one-time funds paid in 2 tranches. We got one in May of 2021, and we expect the next one in May of 2022. And then also as a reminder, on November 2nd, the board received a report containing proposals on how to use these funds, excuse me, to support a system of coordinated care, as well as continuity of operations around our pandemic response. A couple of those proposals have already been approved by the board. In this case, the Hero Pay for county workers and IHSS, as well as funding for community clinics. The next update on the American Rescue Plan funding will be at the mid-year budget on February 8th. So let's go back to the final rule. Last year in May, the U.S. Department of the Treasury published the interim final rule. The formal name is Coronavirus State and Local Fiscal Recovery Funds. I'll just be referring to them as ARPA funds here today. Then 12 days ago on January 6th, the Treasury issued its final rule for ARPA. And so this verbal report is a summary of that final rule. The final rule takes effect on April 1st, 2022, and the interim remains in effect until that day. Let's see, excuse me a second. Also, that's what I wanted to say. The final rule also clarified that any spending we've done under the interim rule is still in compliance with those funding regulations. So a quick overview of the final rule. The U.S. Treasury developed the final rule so that it allows for broader flexibility and a wider range of uses. First of all, replacing lost public sector revenue, recipients can either choose to claim a standard revenue loss of $10 million or complete a full revenue loss calculation if that's what they choose to do. Also, in responding to public health and economic impacts, recipients could already use the funds for programs and services, capital expenditures to support the overall public health response. But now they've expanded the set of households and communities that are presumed to be impacted or disproportionately impacted, what this does, it results in a greater number of households and entities and broadens the available uses there. Some of the categories it touches are affordable housing, childcare, early learning, and services to address learning loss during the pandemic. It also includes community development and neighborhood revitalization. The third major point the final rule touches is premium pay, and it simply broadens the share of eligible workers there. And the final fourth category is increased eligibility for water, sewer, and broadband infrastructure. I do need to mention the restrictions on the ARPA funds, but there's no surprises here. They're similar to those in the interim final rule. We can't use it to offset net tax revenue. We can't make any extraordinary contributions to pension funds, no payments for debt service or rainy day funds, things like that. So I know I've covered a lot here. It's also available in an off-agenda report that was sent to the board on January 14th. I want to point that out because that report also includes the related documents and links. And so with that, I will stop there and see if there's any questions.
Supervisor Lee?
Thank you. So on the new category, as you mentioned, there's really nothing new other than the fact that they clarify further of the older categories. So for example, underfunding of pension, reserves, those are things that the ARPA funds are not allowed, correct? That's what you're saying.
That's correct.
Thank you.
Ms. Wapinski, I'd ask you or administration, either Dr. Smith or Mr. Marquez, and looking not just at the latest version, but at the sort of where we've landed. What are the biggest surprises and or disappointments and or limitations in the rules at this point? So if we had put ourselves back 6 months ago, knowing that these funds might be forthcoming, but with some hopes and expectations about how they might best be used in our view, what is there that either surprises or disappoints or limits us? I heard the comment from Ms. Wapinski about reserves and pension, obviously, but I'm trying to get a sense for how our county reacts to this information. Anyone?
Sure, I'll see if the chief operating officer wants to pipe in a second, but I think I'd start out by saying, if you ask about surprises, I was very pleasantly surprised at the increase in the scope of eligible uses, that the new rule has broader flexibility. We have a wider range of eligible uses. And so I was pleasantly surprised, as I said, there. I wasn't disappointed in anything I saw in the final rule. As I mentioned, the restrictions remained pretty much the same as the interim. And I think this allows, I had mentioned those proposals went to the board on November 2nd. I think this also supports those proposals that the board has seen already. It just gives us a greater degree of flexibility. So if I was to, I'm pretty excited actually about the final rule. I don't know if Miguel wanted to chime in.
Mr. Marquez?
Oh, it looks like he may have been disconnected, but yeah, that's the long and the short of it, Supervisor.
All right. Anything else on this item, Ms. Wapinski or Ms. Christian? Are we turning next to the folks at Prime?
Supervisor Smitty, yes, we are. And there's just a small change in the order. Rich Mead will speak first, followed by Akilla, and then Aaron will wrap up for Prime Policy Group.
Thank you.
Thank you. And Vice Chairperson Lee mentioned the Build Back Better bill, and I'll start there and then turn to appropriations after that. So Senator Manchin on December 19th went on television to say he couldn't support the Build Back Better bill that passed the House. He left the door open to possibly support a different version of it, but clearly he wanted to go in a different direction than the House did. Since then, there's not been a real earnest negotiation with Senator Manchin over this legislation. There's talk now of doing a number of things, and my partner Aquila Powell was going to pick up on some of this in her presentation. But there's talk of maybe trying to see if some pieces of this Build Back Better plan can go on the appropriations bill, or there's also talk of having the House repass some of the pillars or big pieces of it, like the child tax credit, with hopes of trying to build a bipartisan coalition in the Senate around pieces of this bill. But there's no concrete plans yet for any of those efforts, just some rumors and speculation. So why don't I pause there to see, Vice Chairperson Lee, if you've got any questions specific about that bill before I turn to the appropriations process.
Thank you. Yeah, so that has started as a very large price tag initially at 3.5 trillion. It got kind of whittled down to 1.5, 1.7, 1.8. There's a bunch of numbers flying around, and now that with the latest development, it sounds like there's really no further movement on this. We just don't have to vote if Senator Manchin or Senator is not willing to join in. So I just want to see, do you see any path forward other than getting the discussion talking again with those two senators?
Well, a couple of comments is I wouldn't declare the bill dead, but I think it's on life support, to be honest. I know there's a lot of motivation amongst a lot of Democratic members of Congress to try and pass something before the president appears before Congress for his State of the Union address on March 1st, but I'm not quite sure what that could be. Senator Manchin, for example, while he's not opposed to child tax credit per se, he wants to see if they're going to do it for full 10 years and means test it. Well, that may not be acceptable to some of the more progressive Democratic members. So I'm not quite sure what path, if any, exists for moving forward on Build Back Better.
Thank you. It's a sad testament of where we are right now, but it is what it is. But thank you for the report.
And just to add to that, it just is indicative of the very partisan environment we're in Washington. Unfortunately, there's not much, if any, bipartisan cooperation. So, having said that, there may be some hope around the appropriations process. As Ms. Christian mentioned, the federal funding of our programs expires on February 18th. And I think both sides of the political aisle and both sides of the Capitol want to see full appropriations bills and not do another long-term continuing resolution. And in fact, the House Appropriations Committee, Defense Subcommittee held a hearing earlier this month on the dangers of a continuing resolution, because under a continuing resolution, the Pentagon and other agencies can't do what we call new starts. So any new contracts, any new projects can't be initiated under CR. And there's a lot of vital, equipment and other things that the Pentagon wants and needs that they couldn't do under CR. So they're really trying to push for full appropriations bills. And in fact, under CR, the military would also face a funding squeeze, because of the continuing resolution would fund the military at $698 billion. And that's compared to the $777 billion that passed as part of the National Defense Authorization Act. And so the thinking is that the Democrats will try to put more money towards defense, whether they go up to the full $777 billion or just a lot higher than the $698, in order to draw Republicans in so they support more non-defense spending and possibly some other items. And again, my partner, Aquila Powell, will talk to some of those items that may come in as part of this package. What we call the Four Corners Appropriations Committee, the chairman and ranking member all met last Thursday and had a very cordial and good meeting. And while there wasn't any specifics outlined, they made some progress, and they all spoke favorably about the meeting, which is a good sign. That the thought is that there can be a consensus over an omnibus appropriations act, meaning all of the appropriations bills put together as one package. So there's hope that they can get a consensus there. Now, there also is talk that they may not be able to do so by February 18th. So maybe another short-term continuation resolution may be needed to get them into March, for example, so that they can get that bigger, fuller set of appropriations passed. With that, I'll turn to my partner, Aquila, to talk about some other items that may work their way into the appropriations process.
Hello, Chairperson Lee and Chairperson Simidian. It's great to see you guys again. As Rich mentioned, Congress is continuing debates around the CR. And one of the things that they're looking at adding on is another stimulus package. Senator Wicker of Mississippi and Senator Cardin of Maryland are working on a stimulus bill to provide some relief to restaurants, gyms, and other small businesses. Initially, it was just going to be those three industries. However, with COVID raging on, talk has started around adding on more things. The White House is apparently preparing a COVID relief package to send up to the Hill, according to Congressman Hoyer. We learned that last week. However, another stimulus package does have challenges in terms of getting enacted. We already know that there's Republican opposition. There are some Republican senators that are concerned about the cost and they want offsets. There's also some Republican senators who are concerned about unspent COVID money. This would be the fourth COVID stimulus bill. And there's thought that there's still quite a bit of money out there that hasn't been spent. And we also recognize that there may be some other poison pills added to this, possibly from progressives that are upset about Build Back Better not getting enacted. And they're looking at pretty much any vehicle out the train station that they can add some things on to. Thank you.
All right. Supervisor Lee, questions? Thank you, Ms. Powell.
Thank you. I have no further question.
All right. Ms. Powell, risk of stating the obvious, having listened to both you and Mr. Mead thus far, it sounds like we're at a point where there's a lot of possibilities, but not much clarity or certainty about what comes next. Is that a fair summary of where we are?
Very fair, very fair.
Thank you. And are we hearing from Ms. Dorton as well today?
Yes. Hello. Good morning.
Nice to see you.
Having me. Nice to see you. So my portion of today's presentation is focused on the federal government efforts surrounding COVID testing. Currently, the administration testing effort is focused on in 4 areas: increase overall testing supply, increase the number of tests authorized, increase the number of places to get tested, and increase access to free testing. Last week, the White House made announcements which build on this effort and will further ensure equitable access to free testing, on which I will focus my update. President Biden announced last Thursday that the administration will buy another 500 million at-home COVID-19 tests, in addition to his plans to order the 500 million he announced last month. The website, a website covidtests.gov, will launch tomorrow, January 19th. So Americans can order from the first batch of 500 million free tests. It's expected that they will then ship about 7 to 12 days from the time of order. The administration has partnered with the U.S. Postal Service to facilitate the mailing of these at-home test kits. The Postal Service has hired upwards of, I've heard, about 7,000 temporary workers, some of whom were already employed for the holiday rush, to package and address the test kits at 43 fulfillment centers around the country. All orders in the continental U.S. will be sent through the first-class package service. There will be free tests available for every household, and to promote broad access, the initial program will allow 4 free tests to be requested per residential address. As noted, as of now, this effort is for that first 500 million. It's unclear when the additional tests will become available or if they will just be added into this process. The administration is taking a number of steps to ensure this program reaches the hardest hit and highest risk communities. This includes prioritizing processing prioritizing processing orders to households experiencing the highest social vulnerability and in communities that have experienced a disproportionate share of COVID-19 cases and deaths, particularly during this Omicron surge. I'm told that the current plan is prioritization of the first 20% of orders each day from high social vulnerability index, zip codes. They will also be launching a free call line so that those who have difficulty accessing the internet or need additional support can phone in orders for their tests. And they'll be working with national and local organizations with experience serving communities of color, people living with disabilities, and other high-risk communities to serve as navigators to raise awareness about the program and help those people submit requests. The administration is working through a contracting process for the purchase of these 1 billion at-home rapid tests. The Department of Defense, in coordination with the Department of Health and Human Services, has already awarded several of the contracts that will result from this process, with over 420 million tests already under contract. Given the volume of tests being procured and the diversity of manufacturers, it is expected that additional contracts will continue to be awarded over the coming weeks. The White House has indicated that the contracts are structured in a way to require that significant amounts are delivered in an aggressive timeline. The second part of the free testing effort involves the insurance companies. The administration announced last week new details on how Americans can get free COVID-19 tests via reimbursements from their private insurance. Under the new policy, individuals covered by a health insurance plan who purchase an over-the-counter diagnostic test that has been authorized, cleared, or approved by the FDA will be able to have those tests covered by their insurance. And this policy was underway, began this past Saturday, January 15th. Insurance companies and health plans will be required to cover 8 free over-the-counter at-home tests per covered individual per month, according to the White House. For example, a family of 4, all in the same plan, would be able to get up to 32 of those tests covered by their health plan per month. The administration also says it's incentivizing insurers and group health plans to set up programs that will allow Americans to get the over-the-counter tests directly through preferred pharmacies, retailers, or other entities with no out-of-pocket costs. In addition to these new efforts, there are many other options for testing. There are now over 20,000 free testing sites across the country, as well as federal surge testing sites, with more free testing sites opening each week. To date, millions of free at-home tests have been delivered to thousands of community health centers and rural health clinics to distribute to their patients, with more delivered each week. In addition, the administration provided schools $10 billion in American Rescue Plan funding to get tests to K through 12 school districts. And the administration invested nearly $6 billion in ARP funding to cover free testing for uninsured individuals and support testing in correctional facilities, shelters for people experiencing homelessness, and mental health facilities. Just last week, the administration took new actions to further increase access to COVID-19 testing in schools. This includes increasing the number of tests available to schools by 10 million per month to help schools safely remain open and implement screening testing and test to stay programs, and supporting free testing access for students, school staff, and families through federal testing sites. Additionally, HHS and FEMA are working with state partners to address testing needs in communities and stand up even more federal testing sites. These, they're calling surge testing sites, are focused on ensuring hardest hit and highest risk communities have equitable access to free and convenient testing. Effective immediately, as the new agencies review these requests, they will consider how these sites can support the safe operations of K through 12 schools. Opportunities to support K through 12 schools may include locating federal testing units on or near school grounds, establishing specific operating hours for students, their families, and school staff, or dedicating a special portion of daily testing to school communities. By incorporating school needs, state leaders can more effectively build school testing into their requests and planning, while surge test sites continue to provide robust access to communities with the greatest need. One last note, the president also said last week that they plan to make high quality masks available for free, and details on that should be coming out sometime this week, although I have heard that there's been a bit of a back and forth on what is the best mask to be suggesting. That's all I have today, and I'm happy to gather more information as needed or answer questions if I'm able.
Thank you, Ms. Jordan. I've got a question or two, and I've jerry-rigged my tech situation here so that you're hearing me on one device and seeing me on another, I think. But let me turn first to Supervisor Lee and see if he has any comments or questions on that bit of commentary.
Yes, thank you, Aaron. Thank you for the updated news. As far as the covidtest.gov website, actually, I tried it this morning and it worked. So
there you go.
Order already. Yeah, so I believe somebody from my staff actually ordered some earlier, and I did it myself as well. An order set for my parents. So apparently it's working. So I'm just trying to get the word out to everybody to basically get out there. But there's not first come, first serve, right? Like you're mentioning, it's going to be based on the most highest socially vulnerable zip codes. So that's
I think they're
going to be, right?
I believe that is my understanding. I have asked a few people who are part of the process on some level, and that is the initial plan, is 20% each day. The first 20% each day will be sort of reserved or focused on or sent to those with the high social vulnerability index zip codes.
Okay, good. And the reimbursement one, which is separate, completely separate from the program, right?
Right.
That in addition to ordering those, I guess those are 4 tests that you're ordering with the federal government directly, you could go ahead and buy those separately through CVS or Walgreens and any of your local places, or buy on Amazon for that matter, right, online. And you're allowed to get, you say, 8 free tests a month per person. As you know, most of these test kits are 2 tests per kit, right?
Right.
You could get 4 of those boxes per month per person. So but that doesn't start until January 15th. So anything ordered prior to that, you won't get reimbursed. But if you save a receipt from January 15th on, in theory, you should be able to get those reimbursed, right?
That's correct. That's my understanding. That is correct.
Got it. All right. Thank you very much. I'll give back to you, Chair.
Thank you, Supervisor Lee, and thank you, Ms. Jordan. Let me just ask, the unfair question of the day goes to you, Ms. Jordan, which is, I am recalling the unfortunate challenges with the website when we were launching the Affordable Care Act and the exchanges. And I guess my question is sort of, are folks optimistic about the ability of the federal government to roll out a program of this magnitude this quickly? It requires a certain ability to be nimble, which is sometimes tough at that scale.
So I actually had the same question when I was first hearing about this. I thought the exact same thing. I thought immediately back to that website situation, which was quite a hurdle. But it has been explained to me, or not directly to me, but that this is more of you just put in your name and address, boom, that's all they need. Whereas that other website required so much more information, and it was such a much heavier lift. This is less intricate. This is essentially a mailing label, right?
Got it.
Presumably they're more confident because it's so simple, so that's the claim.
Well, we will have a chance to assess all that at our next meeting when we see you, and we'll all swap stories. And all right, let me see, Ms. Christian, anything else on this item?
No, thank you. The team and Martha covered everything.
All right, I guess before we let these folks go and we move on to the next item, and I know some of you will be sticking around with us, it sounds to me like there's a relative amount of optimism about the appropriations bill or bills making their way through the system before that February 18th deadline. Is that a fair characterization or assessment based on your experience and observations?
It is. Both sides of the Appropriations Committee seem to be cooperating with one another. And so there's a lot of optimism that that can move.
And to the extent that various jurisdictions in Santa Clara County are looking for that, some of that CPF community program funding, it strikes me that we all need to be mindful of the fact that even if the appropriations bill makes its way through the system on a relatively timely basis at this point, there's still considerable lag time before dollars move out of the system. Yes?
Yes. So the community projects remain in play in this appropriations process. But even if they, let's just say that they can pass a bill with these community projects in it by February 18th, there'll be a lag time of probably at least a couple of months before the agency would actually release the money to the communities.
Thank you. I'm asking only in part because of the County of Santa Clara's direct interest in those funds, but also, as you know, our 5 board members collectively represent 15 cities and towns, 30 plus school districts, and numerous nonprofits, and many of them have hopes of being beneficiaries of that process and have been wondering, and at least in my office's case, in touch with us to say, what do you know? What do you think? And I just wanted to be able to share with them your best assessment of what the timeline realistically looks like, could look like if things proceed. All right, thank you. Then without objection and hearing none, we will receive that report after confirming from the clerk that we had no speakers on that item.
That's correct. There are no speakers.
Thank you. Then I think that takes us to item number 8, which is the county executive's report, presumably again led by Ms. Christian on the county executive's behalf, relating to health policy and budget matters. And I know we have, at least I think we have Mr. Margolin here with us still, and also folks from Prime. So who's going to lead off with what, Ms. Christian?
I'm going to very briefly ask Bert Margolin of the Margolin Group to start this item and provide the report. Thank you.
Thank you.
All right. Thanks very much. Good morning, everyone. So the Prime Policy Report covered much of this terrain already, but I am going to highlight some of the health policy issues that are pending that we should be focused on, and maybe start off with one general observation about Build Back Better. I can't disagree with anything that's been said thus far about the frustration, the confusion, the uncertainty about Build Back Better, and the very strong possibility that it doesn't get revived. I know that it's an uphill battle and it may in fact be dead, but my own view is that there is a reasonable chance that some version of it does get revived over the next 2 months. And when I say some version of it, it may not be called Build Back Better, but there are so many components within the House passed bill that have such strong support from Democratic members, and you have this Democrat-only 50-vote reconciliation process that's available to them. And even though there are hard feelings, hurt feelings, a lot of bitterness on all sides about the way things fell apart in December, it's just very hard for me to imagine that come a month or 2 or 3 from now, some smaller package isn't assembled and passed using reconciliation 50-vote margin. So let me just focus for a moment on some of the healthcare policy pieces that were in the House passed version of Build Back Better that could be part of this revived package. First of all, we have the ACA subsidies, the Affordable Care Act subsidies. They were passed in the American Rescue Plan, designed to make healthcare under the ACA more affordable for people who are currently receiving subsidies, more generous subsidies, but also designed to provide subsidies to people beyond the 400% of poverty limit in the original ACA. They're going to expire in December of 2022, December of this year. The Build Back Better proposal passed by the House extended them for until 2025. Again, there's very strong Democratic support, Senate and House, for somehow getting that provision through. That's not likely to be part of any kind of bipartisan appropriations process because of Republican resistance to ACA provisions. But again, reconciliation is available, and it's hard for me to imagine that there won't be a serious effort to get these ACA subsidies housed in a reconciliation package. There's also a prescription drug benefit reform that we've talked about in past meetings. The bigger version of that reform did not survive the House process, but a breakthrough, very consequential, smaller version did survive, which gives for the first time the federal government the authority to negotiate drug prices. It only applies initially to 10 very limited drugs, but then it builds up to a larger number over time. And while there are limitations on which drugs can be negotiated that are more severe than the original package, it is a breakthrough. It is something that Democrats, at least many Democrats, strongly support, would like to see advanced. There's also an inflation cap on drugs sold through Medicare. That's part of this drug reform package. There's also a drug pricing reform that deals with the cost of insulin that brings that cost down to no more than $35 per month. There's also a hard cap on out-of-pocket costs for Medicare beneficiaries under Part D. $2,000 would be that hard cap. So it's hard. Again, these are not all of these provisions are equally popular, but again, there are elements of what I've just described that there's broad Democratic support for, and again, possibly the potential now for elements of this being in a revised reconciliation package. There's also an expansion of Medicare benefits that we've talked about in the past. Originally, it was going to be vision, dental, and hearing. It got pushed down at the end in the House to a hearing benefit only. And actually, a major reason why it got limited to hearing only was because when the drug pricing package got restricted to fewer drugs, more limited scope, the savings from the prescription drug package went down, and that savings was going to be used to pay for the Medicare expansion. So as a consequence, the House and negotiators reduced the scale of that package. So there are many other health provisions in Build Back Better that the House passed. These are some of the key ones that we've been tracking. Again, as Prime Policy mentioned, there's talk about making March 1, the President Biden's State of the Union address, a new deadline for trying to get a package to the president's desk. Again, it's an uphill battle. It could easily not happen. But again, I'm trying to suggest here that I think there is a distinct possibility that a smaller revised package could come together because there's so much at stake here for the negotiators on the Democratic side who worked on this issue. And this is an opportunity that if it's lost through reconciliation, most of these provisions have no chance of being passed on a bipartisan basis, given the current polarization in the Congress. A couple of other healthcare issues to briefly touch on. The federal public health emergency was renewed on January 16th for an additional 90 days. This allows telehealth and an enhanced FMAP to continue. That's likely to continue on for some time because that public health emergency is not going away anytime soon. And there are legislative efforts, discussions that have been underway for a while on how to make some of these flexibilities permanent beyond the public health emergency. Last item I want to just mention before turning to any questions you might have is there's been a bipartisan effort underway, one of the few bipartisan efforts underway since last spring, to put together a pandemic preparedness package, not dealing with, again, different from what Prime Policy talked about in terms of the COVID relief package being put together to deal with the current ongoing emergency. This is an effort to deal with a future pandemic. It's being negotiated by Senators Murray and Burr, the two lead members of the Senate Help Committee. Senator Burr, the Republican, is retiring at the end of this year, so it's sort of the last major accomplishment he may try to achieve during his Senate tenure. And while it hasn't been unveiled yet, there I think is some chance that between Murray and Burr, that something significant that would impact the county and our healthcare delivery system might be unveiled and potentially acted on this year. And then one, I said that was the last comment. There's one final comment, and that involves just a reference to the fact that CMS did approve end of December California's multiple waiver proposals that are tied together through something called CalAIM. That's the overall package. And while there's more work to be done on negotiating some of the details, notwithstanding the fact the concept's approved, and while there are issues yet to be resolved as to how that will impact the Santa Clara County system, that CalAIM approval at the federal level is significant and worth noting. So those are the major healthcare themes I wanted to touch on, and happy to respond to any questions or comments you might have.
Thank you, Mr. Margolin. And let's go to Prime, see if they have any other thoughts they want to add, and then take questions and comments from Supervisor Lee and myself in that order, so that if there are questions, either or both offices can respond. Mr.
Sure.
Mead, anything you wanted to toss into the mix at this point?
I don't have anything to add to Mr. Margolin's report, and I don't disagree with him about the priority of getting some things through the reconciliation process by March 1st. So it's just a little bit of a wait and see what they can get done.
All right, Mr. Supervisor Lee, questions, comments? I've got a couple, but I'll defer to you, sir.
Sure. Thank you, Ms. Margolis, as always. So the State of Union is scheduled for March 1st. So now we might have another deadline that we are trying to get this Build Back Better moving. And we'll see if that last try will be able to revive this this bill. I guess right now in health support, as we say, no pun intended. The pandemic preparedness package from Senator Murray and Burr, that's a new one that I haven't heard about. That seems exciting because it's bipartisan, and it certainly is completely separate from the Build Back Better. Can you elaborate a little bit more? What are we talking about? How much is that going to affect? How much money do you think is going to be put into this, and how would that affect us? Is this going to be something that will last much longer, so that in the future case when, you know, what is another COVID variant or a different type of pandemic coming through, this is supposed to cover all those type of cover disaster relief type issues?
So those are all good questions. I wish I could respond to them with some level of detail, but all that's happened is since the two senators announced that they wanted to do this last spring, they've been gathering information from stakeholders and working behind the scenes to develop a package which has not yet been released. So while it will be forward looking and forward thinking, and it will provide, because it's designed to build up the public health infrastructure. So in theory, it should benefit the Santa Clara County system, one of the, the key public health systems in California. We don't have any information yet about size, scope, or cost.
Got it. Thank you.
Thank you. Mr. Margolin or Mr. Mead, I just to sort of tease out the possibilities of, it sounds to me like I might appropriately characterize what you described, Mr. Margolin, as Build Back Better light. Is that kind of what you're thinking folks are looking at or hoping for or aspiring to as a second best proposition?
I think people thought in December that the negotiations with Senator Manchin were not going to go the way they went, with that abrupt termination and blow up. And yes, it is a smaller version. And even though there was some White House and some substantial unhappiness with the degree to which Senator Manchin wanted to push down the scope of Build Back Better and all the objections he was raising, people still thought through the moment of his announcement, Senator Manchin's announcement that the bill was dead as far as he was concerned, that he would agree to a smaller version. He in fact put forward a proposal that involved universal pre-K, Affordable Care Act support. He had his own blueprint in mid-December of a smaller package. So everyone's angry at everyone else right now, and there's a cooling off period. And obviously, there's a focus now on voting rights and and getting obviously the omnibus through. So there are other issues to preoccupy people. But I do think, I think yes, it is a smaller version of what was already a reduced package. That's a fair way of characterizing. It will be smaller.
And so essentially, one possibility is, and I understand that we'll see, but one possibility is that somebody or somebody's in the system has the legislative wherewithal to say, let's pick these 3, 6, 12, 20 items on which there is at least a consensus on the Democratic side, move that through as a single piece of legislation, and then come back on 3, 6, 12, or 20 other items one by one if they think it's worth the legislative effort to make their case. Is that a plausible prospect? I know there's no certainty here.
There's no certainty. So again, I would argue that what they may be thinking about, even though I know there's been talk over the last day on the House side about breaking apart Build Back Better into individual bills and trying to move those bills, given the way the Senate operates and given the nature of what those bills would say and do, it's unlikely that those bills would survive a Senate process as individual bills. So another way of characterizing what you just said is they can do a smaller reconciliation package with the vehicle they currently have, and then hold out the carrot for those people on the Democratic side disappointed at issues that were lost by saying, listen, we have in 2022 another reconciliation vehicle that we can generate, assuming they decide to go down that route, and sometime later this year use the second reconciliation vehicle to try to negotiate another package of smaller provisions. Again, I'm not sure a second reconciliation could survive the process, but that's probably a bit more likely than individual bills surviving.
And we're deep into the process weeds here, but what is it that, quote, creates a second reconciliation vehicle? And Mr. Margolin, you're a former state legislator here in California, so you know that to some extent I'm a victim of my experience having legislated in California, where we put, big things and small things into standalone bills and move them through the system and to the governor's desk for a signature, as contrasted with the situation at the federal level, where it seems an awful lot gets tossed into one great big package of an omnibus bill and moved through the system. So how does someone simply say, gee, wouldn't it be nice if there was another reconciliation vehicle? Where does that come from? How does that happen? And Mr. Mead, if you want to chime in here, I know you're a process expert too. So, and I see Mr. Margolin nodding like he'd be happy to let you chime in. So go right ahead, Mr.
Let me start with one comment and turn to Mr. Mead. It begins with a budget resolution, and Mr. Mead, I'm happy to defer to you to talk about that process, but it begins with a budget resolution.
That's correct. They can move a budget resolution for fiscal year 2023, which starts October 1 of this year. And they can move that through the House and Senate floors. And albeit it's a little bit of a lengthy process because they have what they call the vote-a-rama in the Senate that they'd have to face, but nevertheless, they could do a separate new reconciliation instructions as part of the fiscal year 2023 budget.
And is that done with sort of a wink and a nod, understanding that it's not really going to be used for budget purposes, or is that pretty by the book in the sense that no, ultimately it will have budget implications and be used for budget purposes, and for that reason it's appropriate to use it as a reconciliation vehicle?
So the so-called Byrd rule dictates that the provisions in the reconciliation bill have to have fiscal impact in order to remain in. And so, yes, while the budget resolution may not have much enforcement beyond the reconciliation will be a legitimate fiscal piece of the puzzle.
Right. Yeah, it definitely has to be all budget related. If the Senate parliamentarian and the Byrd rule ensure that that's the case. And again, there may not be an appetite for doing this. As Mr. Mead pointed out, there's that voterama process and it is lengthy, and but if to deal with the disappointment that many Democrats may feel at having this current reconciliation package scaled back, assuming it even survives, again, we're just speculating that it might survive, this other 2023 focused reconciliation process is an option. Again, you also could try to get things in, as was said earlier, into the appropriations process, and there are some provisions in Build Back Better that might survive that, but if they're identified as Build Back Better and they're identified as being generated by the Democrats, it's going to be, most of them are going to have a hard time getting Republican support in the current polarized environment. So 50 vote mechanism is the best route. I'm sorry, Mr. Chairman.
No, excuse me. And thank you everybody for your patience with the clunkiness of the technology today. So another way to come at this, as we're all trying to figure out what's coming our way or not, is to say, Senator Manchin, Senator Sinema, here's the Build Back Better bill. Why don't you tell us which provisions you don't like, and we'll move the rest of it as a single package. I know that's a bit of a gross oversimplification, but realistically, it sounds like that's sort of where we are. Yes, gentlemen?
We're there to some extent, but the problem that the White House has with doing it quite that directly is they've got the progressive Democrats in the Senate and the House who won't necessarily accept that model without some tinkering and changes. Again, people were so upset about the loss of this package in December. Democratic members were so upset that there's a process here of grieving and that they're going through. And initially, part of the reason why people think I think conventional wisdom has been that it's all dead is because people have been so angry at what was done to the package in December. They can't imagine renegotiating. But when the stark reality of nothing being passed begins to be more fully understood and felt, I think some version of what you just said is going to happen. Although, again, the White House will have its views as well, and progressive Democrats will push back on some items. It is controlled by Senators Manchin and Sinema. Yes, that is correct.
And not to put words in your mouth, Mr. Margolin, but what I heard you saying is, yeah, they'll toss the stuff that just won't fly with Senators Manchin, and they could toss the stuff that doesn't work for Senator Manchin or Senator Sinema, but that might also prompt some advocacy from the more progressive members who say, well, if we have to sacrifice this, that, and the other, we at least want to beef up the following 2, 3, 4, 5, 6 things that we think could be better than we had seen in the original bill. Yes?
Right. Yes, because you have the issue of the substance of what's passed, which again, I think you could pass even something much smaller than 1.75 trillion, and it could be quite consequential. If we'd been talking a year or two ago about universal pre-K as the only thing Democrats were going to attempt to accomplish, and they got that one thing done, that would be considered a landmark accomplishment. But because of the scope of the original Build Back Better, it's so massive, so far-reaching. The expectations have been raised so high. So you have the sort of the political expectation side of the equation. You could do something that's quite massive, but if it falls too far below expectations, people will say, well, this is just a very weak fallback, and it will not, and it'll be widely criticized. So the White House has to sort of manage all of that. You're dealing with expectations that were set very high, and they're now rapidly descending. And actually, in one sense, to the extent that in our earlier conversation, we all were saying, and many of us were saying, maybe nothing will pass this year. If the expectations reach the point where people assume that there's nothing that's going to pass, it might be easier to get people to look at universal pre-K and some of these healthcare provisions as consequential, because it's a lot better than nothing. And in fact, in any given year, any normal year, they'd be considered major accomplishments.
All right, Mr. Mead, anything else?
The only thing I'll add to that is, and I think Mr. Margolin alluded to this, is, one of the challenges of, sort of having Senator Manchin dictate all the parameters of the bill is the margins are so thin in the House. It doesn't take many progressives. If they say, we can't support that, it doesn't take many of them to blow this whole thing up. So, and I'm not predicting that outcome. I'm just saying it's sort of this very fine line they have to walk to keep the progressives on board and do enough to satisfy Manchin and Sinema.
All right. Anyone else from Prime want to weigh in? Ms. Powell, Ms. Dorton?
No, thank
Okay,
you.
good.
No, I'm all set, but
All
I
right,
agree.
just wanted to make sure our Zoom format here wasn't precluding further comment. All right, well then, let me just confirm with the clerk that we have no speakers on this item.
That is correct.
Thank you. Then Supervisor Lee, without objection and hearing none, we will deem the report received, and for the clerk and for purposes of our minutes, if there were any items 4 through 8 on which I failed to indicate that we would receive the reports without objection, I will say that now. Ask if there's any objection. Hearing none will indicate that items 4 through 8 inclusive were in fact all received without objection. And I believe, Supervisor Lee, unless you have one more thing, that we are now prepared to say thank you and adjourn to our next regular meeting on Wednesday, March the 2nd. Supervisor Lee, last word.
No further, and I just want to ask everybody to let them know that this covidtest.gov is something that they need to jump in and sign up, get your free 4 test kits for every person. So just do that ASAP. That's all.
I'm going to give you a me too on that, and without objection, our meeting is adjourned. Thank you all, and thanks for your patience with the challenges today. Take care.
Thank you.
Bye, thank you.
Thank you. Stay safe.
Recording stopped.